Hi, everybody. Todd Maddox here again. I am the host and moderator of Reimagine Medicine. And today I have the honor and privilege of interviewing and really spending some time chatting with one of my favorite people, a good friend and colleague, Rohan Jotwani. He's an interventional pain specialist and anesthesiologist, and he is the Nanette Laitman Scholar in XR and AI at the Weill Cornell Medicine. And that's his day job. His side job is as editor-in-chief at the Journal of Medical Extended Reality. So, Rohan, welcome to our podcast.
Thanks for having me, Tom. It's a pleasure to be here.
All right, cool. Yeah, no, I'm thrilled to have you here. So, let's just start with share a little bit of background on you and kind of what led you to this intersection of medicine and immersive technology.
Yeah, of course. As you mentioned, my day job is as a pain specialist and an interventional one at that. I take care of patients who have all kinds of chronic pains from head to toe. Outside of that, I'm also still practice as an anesthesiologist in all different kinds of setting. So whether, you're the kind of patient who comes in because you've had a trauma or a car accident, or you're about to deliver a baby and you need an epidural, or you need, care during a C-section, or, you're in acute pain in the hospital and maybe need a nerve block or a epidural catheter. I play all those roles as well. So I get to see pain from kind of all of these different angles, whether it's, you're a patient who's really never had pain in your life, and this is your first time really experiencing 10 out of 10 pain, like during labor and delivery, or if you live in pain every day and your baseline is a 10 out of 10. I'm kind of like your doctor. So from that perspective, I feel like I came into immersive technologies with regards to pain medicine when I was a fellow. So when I was training as a fellow and I was trying to learn all these different procedures, I remember realizing that there was just so much to learn. And the problem was I'd go home and I'd be preparing for the next day, and I look at all this anatomy in 2D and in textbooks, and I'd look at images, and I felt like there was something missing, like there was some dissonance there where I kind of understood the procedure, but I didn't really understand the procedure. I remember actually around this time, I think it was Black Friday, I decided to just buy a headset for myself and started looking anatomy at 3D. And surely enough, by the new year, I felt I had gotten way, way better at the procedures. And that was really what made me a believer, because at that stage of my training, I'd already been a physician then for like 5 years. And the fact that I was learning new things every day in immersive environments made me think, okay, what are other applications for this? So I don't know, I'd say that's pretty humble beginnings, but it sort of took off from there.
I love that. So, around the education and training piece for you as a healthcare professional, that's where you kind of started, and you were like, wow, I'm learning so quickly, learning about a three-dimensional system with a three-dimensional training tool. What a concept, right?
Right. I mean, the shocking part to me, I was like, why has it taken me, 4 years of college, 4 years of med school, 4 years of residency, so 12 years, and then it's halfway through my fellowship, my last year of training, I was like, wow, I didn't even know that this was a thing.
Wow. I love that. I and obviously resonate to that as a learning scientist, but supercharging the learning and just getting that knowledge into your whole brain and your whole learning system so quickly. Excellent. That is very cool. So as I mentioned at the beginning, sort of the theme of our series here is reimagining medicine. And that's, it's like really, really broad. So I'm not going to ask you to, tell me what you think about reimagining medicine in all aspects of medicine, but in certainly in your area of expertise. What does that mean for you?
Yeah, it's a huge question. Sometimes I think about it like if I didn't know what I know now, right? If I hadn't been in practice for, a couple of years, if I hadn't gone through the system of training, how would I have imagined medicine? And I know it seems a little bit naive, but it would be like, okay, we would design solutions to problems based on patients' needs without thinking about what the system needed. So we would just practice basically, what does it take for this patient to get better? What does the evidence shows us for this patient to get better? And then just give it to them, right? Like it wouldn't be so complicated. The problem today is, now that I know how the system actually works, Todd, I'd say it's a little bit like Hollywood. So in Hollywood, actors often have a sense of like, if you want to do an indie film, right? You want to do
Yeah.
your indie film and progress the art of what you do. You also have to do the occasional blockbuster, or the situation kind of falls flat for you as an
Yeah.
actor.
Yeah. Yeah.
I'd say what I've learned over the years is health systems are a little bit like Hollywood. Like they want to do their indie films and help people out and do the kind of interesting new things that really advances the science. But they've got to make payroll, and they've got, costs, and everything gets more expensive every year. And every
Yeah.
year we get paid to do a little less than the year before. So,
Yeah.
it's always a struggle between the indie films and the blockbusters.
I like that. I like that. It's like the innovation, right? The forward thinking part, but we also have to be practical, right? And it's
Yeah, right.
balancing those two things. You have to be practical in order to do the innovation, or it's just a pipe dream. You're not actually innovating. You're just thinking about it, but you're always striving for that innovation. That's good. Good. I
And,
that's actually
and
pretty similar to what I'm thinking. Yeah, please.
yeah, no, I mean, I think all of us who work in the innovation space kind of hit the same thesis at the same point, which is like, how do I turn my innovation into a blockbuster?
Yeah, totally. Totally. Cool. So let's sort of hone in on immersive therapeutics. That's something that we're both, you know, intimately involved with and pushing forward. How do you look at immersive therapeutics and XR in medical in general? So clearly your expertise. How is it different from sort of traditional digital health?
Right. So to me, right, anytime you're bringing immersive technologies into the healthcare space, whether it's for a direct patient application,
Mhm.
it's for training, it's for making physicians better themselves, like in the operating room, wearing an immersive headset in order to be able to see a patient's anatomy while you operate. The core thing that makes it different is that it's an entirely different kind of computing, right?
Okay.
It's a kind of computing that's not limited by the realities of a 2D screen.
Okay.
So
Yeah.
one thing that I almost lament about training these days, like if when you're going through that med school and that residency process, is how much the 2D screen has kind of become like our kryptonite as physicians. There are scores of residents who, for most of their days, don't even see patients as much as they used to. Maybe they'll
Okay.
see them for morning rounds. Maybe they'll see them a couple of times if there's something that needs to happen, nursing wise, or they get paged to come see a patient. If there's a new admission, they'll go to the ED and see the patient down there. But by and large, most of a physician's life is spent on a 2D computer, right?
Wow.
Putting in orders, interacting with an EHR system. And, that's done incredible things. I mean, it's allowed us to scale healthcare. Now a patient can go across the country and I could see their records if they're in the same EHR system. But, it's also kind of become a little bit of our kryptonite too, because we're not looking at patients as much as we used to. And sometimes the information itself is locked, right? Like, so in order for me to take care of a patient, I have to sign in, type in my password at least 4 or 5
Right.
times, click the right chart. I mean, it's like a lot of time, right? If I
Yeah.
think about if I did a calculation the other day, just like the amount of time I spent wasted just waiting for the computer to load and to get to the information is probably around an hour a day.
That's
Um,
crazy.
And so when I think about why immersive technologies are different than what we've had previously, if with digital therapeutic, it's the idea that we're basically getting rid of that distance that's created by the 2D screen, where
Oh,
we're
okay.
freeing computing from this, sort of this prison that we've created for ourselves, and we're inviting the right piece of data to us at the right moment while we look at our patients simultaneously.
I love that. I love that. So it's bringing you closer to the patient, which of course has nothing to do with technology directly, right? It's that interaction with the patient, but the immersive component is facilitating that and providing better care for the patient, et cetera, by providing you, the healthcare professional, with additional information. That's cool.
Ironically, it
I
it,
love
it
that.
takes the it takes the computing element and almost makes it part of the background, as opposed to the main thing that we're looking at.
Okay. I'm going to ponder that one for a while. I love that. I
Yeah.
really, really love that. I'm going to move forward though. That is very, very cool because the computing is so important, but it becomes kind of ancillary and brings you closer to the patient. That's cool. That is cool. So this sort of, I mean, you are already kind of answering my next question with that. And what evidence or patient outcomes have most convinced you of immersive therapeutic potential? And you've certainly outlined one right there. It brings you closer to your patients and moves the computing to the back. Anything else to add there?
So what I see from my patients when I'm prescribing immersive therapeutics as part of their pain management is that it gets at the core of what defines really good pain management, which is a multidisciplinary, multimodal approach where the thesis is that we're treating chronic pain like it is the disease in and of itself.
Right.
So many patients come to me, and part of, I think, what's holding back them getting better is the notion that, like, if I have one more surgery, if I get one more medication, if I do one more tiny thing, my chronic pain will go away forever.
Right.
And some patients come to me with the story after having been in chronic pain for like 20 years. So something is off, right? Like something is
Yeah.
cognitively dissonant about that situation. There's almost like an epiphany that hasn't quite been reached.
Yeah.
I can sit with them for hours and we can go through everything and we can say, okay, well, why did the 7th surgery fail? And why did the 8th surgery fail? And why the 10th surgery failed? But the truth is, some of this stuff has to be experienced, you know? And at the core of what immersive technologies are doing is they're helping patients experience that chronic pain actually is the disease in and of itself and come to that
Okay.
realization in a way
It's
that,
not the back. Okay. Yeah, please. Sorry.
right.
Yeah.
No. I mean, you're a
Yeah.
scientist here. You've
Yeah.
dealt with this for your
Yeah.
whole career about how
Yeah.
people learn and what it takes to get that true, sort of neuronal pathway to actually shift. Some of it has to
Interesting.
be experienced because
Yeah.
there's only so much any of us can do in a 15-minute visit.
Right. Right. So getting the focus to where it needs to be
Yes.
on that pain.
Right.
Interesting. Interesting. Okay. And just to be clear, immersive therapeutics facilitate that.
Yes, absolutely. Because
Okay.
immersive therapeutics is the experience that, we struggle with in
Yeah.
healthcare.
Yeah.
I think we have no shortage of medications to offer. We have no shortage of procedures to offer patients. The one things we struggle with offering patients is like simple things like teaching patients like where pain comes from,
Pain education.
right?
Yeah.
You start with this notion of like you go to the doctor's office, they have those pictures from the 1950s, those Netter's
Right.
pictures in the back, but that's about as far as we get. Sometimes they'll have like a model of a spine in a room. We're really lacking the tools to actually do really incredible patient education.
Interesting. Okay. So that makes a ton of sense. So I'm guessing, and sort of leading into where I want to go next, like, what do you hear from your colleagues? So we've identified a number of patient sort of facing relevant issues. What about with respect to clinicians, misconceptions, misunderstandings that you see? Is it just lack of education? What are your thoughts there? Like, how do we get more people on board like you?
I think a lot about, why I, as a pain physician, have really leaned into immersive therapeutics, and whether or not I'm just an anomaly in my field, or whether or not, I don't know, I've hit some kind of enlightenment that nobody else has. I don't believe it's the latter, but I do think what got me to start really thinking about immersive therapeutics was trying to conceptualize just the nature of the problem that I think every pain doctor who practices kind of hits at as well. We've got an incredible burden of problem. 1 in 5 Americans lives in chronic pain. 1 in 10 of those patients in chronic pain is what we consider high impact. So it disproportionately affects their lives in a way that destroys relationships, destroys work life, and ends up becoming, a major problem for healthcare systems. So given all of that, right, we spend a great deal of money and time dealing with chronic pain in our healthcare system. We spend billions of dollars directly, we spend billions of dollars indirectly in terms of lost work. And what I'd say is that we're probably no better at really solving this problem, because every year we have more patients with chronic pain, and many of them feel things are not in their control. So given that, we as pain physicians are always looking for new tools in our toolbox. And, the nature of the problem that we face is highly multidimensional. So we know that outside of being a biological process coming from a certain part of the body, that pain is also a learned process, a learned chronic disorder. And if all we do is focus on the signal coming from the body, and we're not really paying attention to what's happening at higher levels, patients are going to continue to struggle. I think every pain doctor that I've ever met knows this. And every pain doctor has many solutions for dealing with the signal coming from the body, and has very few solutions for what's happening at higher levels. So I don't think it's going to take much to convince them to try something for that secondary problem, that latter, more centralized problem, especially one that doesn't come with the same kind of side effects that happen from a lot of the medications that we give for higher order pain issues.
Right. 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 So we're not that far away. Back to the first thing that you said, is it's not going to take much to get everybody to know this exists, and then get them in that headset, because it's experiencing it that really pushes you over the top.
Yes. Yes,
Yeah.
yes, yes.
Yeah. Love that. Love that. So, I mean, where do you see medical extended reality, immersive therapeutics making the biggest impact today? And it obviously pain. Any other areas that you see?
Well, Todd, just where we're talking about immersive therapies as a direct patient, or are you okay for me to talk about immersive therapies in other areas too?
Absolutely, absolutely. And you even alluded earlier to education, which is really where I came into this 10 years ago. Like, this is the way to teach healthcare professionals,
Yeah.
about
Yeah, yeah,
the
yeah.
body and such. But yeah, absolutely. What, broadly speaking, like, what are your thoughts?
Well, every day, I mean, we hear new ideas, and I see new evidence that people are bringing immersive technologies to healthcare in ways even I can't really imagine.
Yeah.
I
Okay.
think we have more and more surgeons looking to wear headsets in the operating room because they know it makes them better,
Yeah.
right?
Yeah.
They know that being able to appreciate the anatomy right there and then, having that tool, allows them to be more efficient, to make less mistakes. That solution kind of sells itself in some
Yeah.
levels.
Yeah.
On the education side, you know, people who do medical educations are realizing more and more that students, just like patients, learn experientially.
Yeah.
And, there are things that it would take me like hours to teach, one of our trainees, that takes me like 5 minutes to teach in a headset.
Exactly.
Like, people
Yeah.
often ask me, like, why do you do all this work? Isn't it just easier to just, do some things traditionally, like have a PowerPoint? But the truth is, I can give a PowerPoint on a lot of this procedural training that we do in XR. and I choose not to do it. I choose to bring the headset with me and do it because I just think it's way better.
Right. I mean, the goal is to impart information on your learners, not make it easier on you, right? Per se, right? I mean,
Right. Yes.
yeah, I can do a PowerPoint and they don't learn anything, but then I'm done. Like, well, that's not really why I'm here to educate,
Yeah.
and the immersive allows us to do that.
I
Yeah.
think from the patient side, like when we're talking about like actually prescribing this,
Yeah.
there's so much, right? Like there's so much untapped need here. I think when people were first really thinking about immersive technologies in as like the treatment itself, we
Mhm.
came from that world of mostly XR psychology,
Right.
phobias,
Yes.
PTSD, trauma, that whole space. We've now sort of made the migration into pain management, but to be fair, I mean, folks have been doing XR for acute pain management for decades now as well.
Right.
You
Hunter's
know,
work for sure.
Hunter's
Yeah.
work in burn dressing changes,
Yeah.
that's been shown to over and over again to be helpful. The
Yeah.
interesting thing is now how we're using it for more chronic type diseases.
Right. Right.
So chronic
Yeah.
pain, chronic depression, chronic anxiety, right? The things that I think are the hidden epidemics in our society,
Yeah.
I
Yeah.
can,
Eh,
I
Yeah.
see more and more the shift of immersive therapies being something that meets a patient where we should be meeting patients for chronic diseases, which is in their homes and
In their
outside of
homes.
clinics.
Yeah. Yeah. I love that on so many dimensions, right? I mean, the acute piece, and I don't, I mean, I'm going to say it's easier. That's a terrible way to put it, but it's certainly more, here's something happening right now. Let's distract you or let's relax you with breathing. The chronic piece requires, sort of long-term structural and functional change in the brain and yada, yada. And again, it's the same tool, this immersive tool, granted different content, right? The nature of the content is different because the changes that you need in the patient are different, but the delivery mechanism is the same because it just broadly engages all these parts of the brain in whatever way you want with the appropriate content. So I love that. So let's go back to pain a little bit. How do you envision immersive therapeutics fitting into a patient's overall care plan? Like, where does it best fit? Do early on, late? Just what are your thoughts there?
From the moment a patient comes to see me in clinic, right, and I'm learning about their story for the first time, I think I walk into every room saying, how can we end this initial visit with a multimodal plan,
Okay. Love
right?
that.
No patient should be leaving the clinic, especially if they have complex chronic pain, especially if it's high impact,
Yeah.
being like, I've got a simple solution for you. This is what you're getting. You need this one medicine and call me in 3 months and see how you're doing. Right? That's a model that has failed us for a long time. It's an easy model. It keeps the clinic day moving along, but it's
Right.
a model that's truly failing patients.
Right.
So for me, right, the earlier you start an immersive therapeutic for a patient, whether it's concurrent with medications, it's concurrent with procedures, it's concurrent
Mm-hmm.
with surgery, it's concurrent with physical therapy. The heart of what we do is tackling pain from all its different dimensionality.
Right.
So
Right.
I've often thought about if a patient's being, scheduled for surgery, why are we not that day starting them on immersive therapeutics? Right? Teaching them some of their lessons that they're going to need post-operatively.
Yes.
Things like,
Yes.
mindfulness techniques, things like meditation, things like guided breathing, right? I see so many patients who are told you need this therapy, you know, day 10, day 15, day 30 after surgery or after a procedure. And I'm sitting there thinking, well, these are habits. This is stuff that
Right.
needs to be learned. This is a behavioral thing.
Right.
The time to start this was pre-day 15, pre-day 30,
Right.
and so I don't necessarily think about it in terms of like, when is the best time? The day the
Okay.
patient meets you, that is the best time.
Okay. I love that. And it's part of a suite of you're looking at multiple things
Mm-hmm.
simultaneously, but you always have an immersive therapeutic intervention in mind to get started right away because it's adjunctive, it's facilitative of any other kinds of medical procedures that might be needed.
Exactly. Exactly.
Yeah. Awesome. Let's talk a little bit about payers.
Mm.
What are yes, the payers in the room. What is the most compelling argument to convince payers and healthcare systems of the value of immersive therapeutics? I'm glad I'm asking you this and not me.
When I try and think about immersive technologies from a payer's perspective, you know, I try and think about it in terms of competing interests. So one thing about me is I went to med school and business school at the same time. Often, the same week I was taking an anatomy class and a finance class, sometimes even on the same day. So it's core to me to kind of think about things in terms of both clinical application as well as how does this affect the return on investment. And this is something insurance companies care a lot about because
Sure.
insurance companies, they don't want to see chronic pain as a chronic disease any more than a patient wants to see as a chronic disease, right? What they're hoping for is an intervention, and that intervention leads to less utilization of healthcare services down the line. Anytime you create a therapy that's kind of like insulin for diabetics, where it's like you're going to need this medicine month after month, year after year, or things something like GLP-1 agonists, which have a number of great health outcomes as long as you keep taking it.
Right.
We need to show them that immersive therapeutics are different than those other kinds of therapies.
Yeah.
That
Yeah.
the effects are meaningful, they reduce healthcare utilization, and that they have durability, that they last for long
Yeah.
periods of times, even as the headset wears off.
Yeah. Yeah.
And I
Yeah.
think the more we're able to make the story, right, the more actually insurance companies will say it's in our incentive to make it that a patient has access to this because it's really helping the patient and it's also helping us.
Yeah. And if I circle back to something you said earlier, one of the ways to start changing the attitudes of the payers and the way they approach chronic pain is to change the way the patient approaches chronic pain.
Yes.
Right? That there isn't a silver bullet. And that's actually something, I mean, we can probably influence both payers and patients, but maybe patients is actually the place to start. And certainly you see patients every day. So, helping to change that attitude so that patients, sure, we'd love it if your pain went away, and maybe in some cases it will, but in most it won't. But we want to improve your quality of life. Ultimately, that's going to lead to less utilization, and granted, it's a slow process, but maybe that's, changing both sets of attitudes and maybe starting with the patients or at least,
I,
both.
I think you're totally right. I think patients have to be the ones also demanding for this.
Yeah. Yeah.
Right. We need to do a better job of showing, not just directly going to the insurance company and saying, hey, this is the data, but having society in general also pushing and saying, hey, this is something that is a meaningful part of chronic pain care, that is standard of practice. Why are you as an insurance company not covering this?
Yeah. Yeah. Well, so along those lines, what are you hearing from your patients who are engaging with the immersive therapeutics that you're prescribing to them?
The thing that I hear most often is that initial acceptance piece that we talked about, that initial
Okay.
mental shift. When patients go through immersive therapeutics, they come back to me almost like they've had the light shown to them.
I love that.
They see the end of the tunnel. They're like, I get it. This is my chronic pain is my disease.
Okay.
And I have agency to deal with this disease. Because initially the narrative I hear every day in clinic is doctor, I'm coming to you. My body is broken. Fix me.
Yeah. Fix me. I'm yours.
Right.
Fix me. Right. Yeah.
Right. There's a general sense of helplessness, and then there's a general lack of trust in self, right? Because people who have chronic pain truly do believe that their body has betrayed them, right? Something should have healed, it didn't heal. Something should have gotten better. If anything, it got worse. And now the things you were able to do seem so out of reach. And I think the thing with immersive therapeutics is that it enables patients to understand your body is in fact not as broken as you think it is.
Right.
You do
Right.
have the tools internally to get through this and to get back to where you once were. And ironically, one of the ways that we're going to show you that, right, is by changing your reality.
Right. Right.
Right? Tricking you into, for even 15, 20 minutes, believing that everything is okay.
Yeah.
And then if you can, and if that works, right? If we can kind of have you unlearn these pain processes, even in 15 to 20 minutes,
Yeah.
that it's possible for you to do that without the headset.
Right. Right. That is a transformational shift from the patient's perspective, right? From I'm broken, here, fix me, to, you get them in the headset to, oh, wow, I have agency.
Right.
I can actually, with your guidance, doctor, with your guidance, sure, but I have some agency here. I can, and I mean, it's one thing, with respect to the work that I do and the patients that I talk to. This is something I hear all the time, is this agency piece, which I think is fascinating. And you're imparting a lot of that directly to the immersive therapeutic, which again makes a ton of sense. That is very cool. So it sounds like you're hearing, sort of this. Well, you even said essentially the patient comes back and it's like they're looking at it completely differently, like a light bulb went off, and now they're seeing pain in a different way. Interesting. Right. And that's a combination of the pain education as well as, I would imagine, experiencing mindfulness and these kinds of things, and it working. They're feeling better.
I think so, right? I mean, from my perspective, I can tell patients all day long when they come to see me, hey, listen, a key component to this getting better is you basically learning how to meditate or something like that. And then prescribing them a 3-month ticket to Tibet to go to the Himalayan mountains and learn that practice.
Right.
That is not realistic. That is never going to happen. Right. And we can't expect that of, patients who have busy and complex lives.
Yeah.
So to me, even something like physical therapy, right? Like, say you're the kind of person who struggles to, make ends meet and you're working every day. Like, how do I send you to physical therapy 3 times a week?
Totally.
Even if the physical therapist's office is in your neighborhood, which, that's sometimes tricky in and of itself. I think when I think about all the barriers that we create, so for me to offer patients and say, hey, like, there's this way for you to gain control, and it only requires this, 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 and this, and to know in the back of my mind they can never do this, this, and this, is a meaningless solution.
Right.
Now I get to send them to Tibet through a headset.
Yeah.
And a headset that theoretically comes to their house.
Exactly.
So I mean, that to me is really the core of patient access.
I love that.
You've got the therapy, but you've also got the mechanism to get the therapy to the people.
Yeah. And it, I mean, you've been involved in this long enough to know that 10, 15 years ago, I mean, for one, it wasn't available in your home, or at least without a laptop and a tether, right? And those were barriers. Sure, it was still in your home, but it was, even more expensive and required all this computing, and now it's a computer, $300-400. It's a computer in the headset presenting that stuff to you in the comfort of your own home. Like, very cool. Very
Yeah,
cool and
exactly.
changing lives. Okay, we're in the home stretch here. I want you to sort of put yourself in an ideal world. Like, what would the ideal care model with immersive therapeutics look like? Let's say for you in your practice.
Yeah, sure. So let's look at kind of what the vision of spatial computing really is, what it really looks like. Like why are we creating a society for medical extended realities? Why did we even create the term medical extended reality?
Yeah.
It comes down to the notion that we believe that we're creating a new specialty of medicine.
Okay. Like that.
A specialty of medicine where, you're not restricted by a 2D screen, and where computing is a companion to what you do, but not the focus of what you do.
Mm-hmm.
So that world looks very differently than the world that we practice in today. But I would argue that we're not that far away from it. So that world is one where physicians walk into a hospital and they have tools that make them feel like superheroes.
Okay.
Again, right? I think there was an age in medicine where physicians felt truly empowered, and they were going to work every day and feeling like they could make these incredible differences in patients' lives. And having now gone through training and worked where I worked, I can tell you one of the saddest things is a lot of physicians don't feel that way anymore.
Oh,
They feel
interesting.
very restricted, right? And, because it's one thing to like have all this knowledge and have all this ability. It's another thing to spend most of your day writing notes, putting in orders, and, spend an hour a day trying to type in your password into a computer.
Yeah. It's crazy.
Right? Like that is like taking the superhero out of the picture and
Yeah.
putting them in a dark room with a bunch of computers.
Yeah. Yeah.
I think the idea of spatial computing is that we take that back. We make people feel as though they can truly do these incredible things, whether it's in an operating room or in a clinic visit or wherever. I think for patients, it's a way to experience things and learn about things and practice things that give them agency again.
Mm-hmm. Mm-hmm.
Right? So there's some empowerment on their level. And then for learners, right, our trainees, the future of the system, it's really about, empowering them as well.
Yeah.
So making them feel like there's nothing so complex that they can't figure it out, right?
Right.
Allowing them, like I was once a fellow at home with a headset practicing, to make them feel like they can walk in and just be confident.
Yeah.
So I think across all patients, learners, physicians themselves or healthcare professionals, really it comes down to an empowerment that we're
I love
getting
that.
through computing.
And to what you said earlier that I'm going to continue to ponder for a while, the computing is critical, but it's now back here. It's not the focus. It's
Right.
it's actually what's driving that empowerment. That is beautiful.
Right.
As opposed to it being on that screen in front of me.
Well, I
I
mean,
love that.
I know you're interviewing me here, but I mean, as somebody who's been in the space of creating immersive therapeutics, has gone to the FDA, has lived this now for many, many years.
Yeah.
Riddle me this, Todd. Do you think that there's something, I don't know, existentially magical about the kind of worlds that you create for in your patient therapies? Or do you think it's an application that's just grounded in really solid principles of patient empowerment?
Honestly, I mean, confidently say the latter, in a sense that, now I'll caveat that with, I know a lot about how the brain works, and so
Sure.
the way immersive technology engages the brain, it's not magical, but it is unique, right? It is experiential learning, but where the experience and the environment that you can put the learner in, whether that's a healthcare professional, a patient, a training healthcare professional, you can make it anything that it needs to be.
Right.
That is incredibly, and that is kind of magical, right? But
I think you're right. I think I maybe phrased the question the wrong way then.
okay,
I guess the question really is, what is more magical here? The patient's brain in the immersive environment, or the immersive environment itself and the headset and the stuff like that? I think it's the patient's brain. I think
I
that's
mean,
where the magic is really happening.
absolutely. I mean, the headset without a person in it, it's like the forest with, can you hear the tree fall if you're
Right.
not like, right? I mean, but the magic is the interaction of the two, right? And
Yes.
in
Yes, yes,
fact,
yes.
when the environment can change as a function of what the patient is doing, now it's even more magical, right? Because
Right.
now there's that interactive component, and that's where AI, which I know you're deeply into, and precision medicine and all this. I mean, that's we're right on the forefront there. So actually, that leads to my last question.
Mhm.
We're sort of touching on this, but really, like, what excites you most about the next phase of immersive medicine?
Well, I guess what excites me most about where we haven't gone yet as in this field of
Yeah,
medical extended reality, honestly, Todd, is people like you. So I know the technology is going to get better year after year. You know that, and I know that the headsets will get fancier, and the technology will just continue to get better. But what really excites me today, right, is that for the first major part of your career and the major part of my career, neither of us were actually that into virtual reality or extended reality, right?
not at
Like
all.
you didn't know you were going to be doing this probably 10
No,
years ago. I
no
didn't know I was going to be
way.
doing this 5 years ago, right?
Right.
And we just we got in here and we just started building. We started
Yeah.
creating and we let our imaginations kind of take the better of us, and
Yeah.
we realized that actually anyone could do incredible things in this space.
Yeah.
I'd say most people, whether you're a healthcare professional or not, don't know that yet.
Yeah.
They don't
Fair
know
enough.
that the barriers have been dropped in such a way where, you know, it doesn't matter if you've never learned how to build virtual worlds in Unity or Unreal Engine. You know, the the tools that you need to do really important work in this space, they're getting easier and easier to use every single day.
Yeah.
Which
Yeah.
means that in the same ways that like maybe 20, 30 years ago, kids in their garages were building websites and those websites became, these monoliths and these revolutionary ideas. In the next few years, there are going to be a bunch of kids, or a bunch of medical students or a bunch of, physicians, sitting around and being like, hey, what if we built this thing in spatial computing and then that is going to evolve into something pretty revolutionary. So that's
Yeah.
what excites me is that
Yeah.
we haven't even seen the greatest ideas yet.
Yeah.
But
Yeah.
every day we inch closer to somebody being able to figure it out.
I mean, that's got to be half the fun of being the editor of the journal. Is you're getting those
Yes.
early insights into just this most exciting stuff.
Yes. Yes,
Yeah.
exactly. I mean,
Yeah.
some of the stuff that people present to me, I'm like, wow, I didn't know that you could do that.
Yeah. Yeah. Totally. Totally. Cool. Cool. Awesome. Hey, Rohan, as always, I love talking to you, bouncing ideas off. Love hearing your thoughts. I'm going to keep thinking about computing, and I really love that analogy. But, thanks for the time. Thanks for your insights. Thanks for what you're doing to push this field forward. And again, always in the interest of patients, which is why we're all here. So thank you.
Of course. Of course. Thanks for having me as always, Todd.